Before we dive into today's episode, I want you to think about the last moment in your life when pain didn't even occur. What's going on with you postponing all of the treatments that could prevent feeling that pain? Today, we're going to talk about the best and perfect solution to treat that pain. In this episode, we're going to discuss a lot of the concepts and the treatments that include regenerative practices in medicine to, of course, help with that pain. And I would like to introduce you to our specialist here who is going to tell us all about regenerative medicine. Welcome, Dr. Ernesto Nieves. Could you please tell us more about you and what you offer here?
Okay, thank you very much. It's a big pleasure to be here and share something that I love. It is share knowledge about different topics, mainly in this aspect, this field that is regenerative medicine. Yes, I'm going to talk a little about me, my history. I'm a medical doctor, I'm generalist surgeon, I'm vascular surgeon with some studies and a background in regenerative medicine. So I have my own clinic that is specialized with my doctors working in this field, in regenerative medicine and how we could help the people to have a better quality of life.
That's incredible. I just wanted to mention that Dr. Nieves has more than 10 years of experience with all of those treatments that we're about to get a closer look on. So to start off, I want to, dust a little bit and let's get straight to the point about the concepts. Do you mind explaining us what regenerative medicine is?
Yes, of course. Your body has a natural ability to repair itself. When you cut your finger, the wound closes and skin grows back. When you break a bone, it heals. That is not magic, it's biology. Regenerative medicine simply bots that capacity. It takes the tools the body already has, concentrates or stimulates them, and delivers them exactly where there is the damage.
And now for the big question, what are stem cells?
Okay, the stem cells are beautiful and nice cells. Think in that cells like a blank cells that haven't decided what to be yet. They can transform into cartilage, bone, muscle, or skin cells. Whatever cells that you need, he could transform. And it's a natural ability that we have with these cells. They are found in bone marrow, fatty tissue, and umbilical cords. Most importantly, they have the ability to go where there is an inflammation or a damage and being the repair process. They start all this repair process. And this the main aspect of these interesting cells.
Wow, that's very interesting. They seem like a really good, helper on the process of regaining confidence and probably avoiding pain. I think that surges a question. What is the meaning? I've seen a lot of like medical resources referring to this specific acronym, which is PRP. What's that?
Okay, the PRP now is acronym that is famous in many aspects.
Okay.
The PRP stands for Platelet-Rich Plasma. We take the patient's own blood, centrifugate it to separate and concentrate the platelets, and inject that concentration into the affected area. Platelets are the coordinators of repair. They are the first to arrive at an injury. With PRP, we are delivering as much higher dose of those repair signals exactly where they are needed.
Okay.
And are perfect to repair muscles and help to coordinate this process of reparation.
That's great. Well, I am no doctor, but the explanation that you're given, it's really clear for me. But I think that the public and the audience is going to be with me on this one. I also have a question about what is the meaning or what is the function of exosomes?
Okay, the exosomes are fascinating. Exosomes are like microscopic messengers, thinning vesicles that self-release to communicate. They carry instructions like a regenerative phase or reduce the inflammation by applying them therapeutically. We send directly repair signals to damaged tissue without needing a full cell transplant. Is something therapeutic with from free cells. Is like the messengers that are into these stem cells and take all the information that the cells need and say, okay, we need to repair, we need to reduce inflammation, and all these signals are into these thinning vesicles. Are impressive.
Wow, that's really clear for both of us, I think. And finally, Dr. Ernesto, what is platelet lysate? Don't mind my pronunciation. You are the expert.
Okay, the platelet lysate is something interesting because into the platelets exists many chemical substance that help the body to regenerate. And we take these platelets and open and release these interleukins and other growth factors and deliver into the area that we need to work. Is used in a high precision trainings to stimulate regeneration at that cellular level. All four have one thing in common. They are in foreign chemicals. They are a biological material that the body recognizes and knows how to use.
Great. Just to finish off this section, Doctor, what would you say is the most important thing to remember about regenerative medicine?
Regenerative medicine is medicine from now. It's not a medicine from the future. It's a medicine that we could access right now. And this medicine use substance that are produced from cells, or even we are using live cells that help the body to recover and repair where is the damage. And that is the most important. It's not a chemical, it's a life substance. And this is the most important. It's an intelligent medicine that helps the body to recover. And it's amazing. The result that we have with many patients are nice. And I think that giving all this information to the people and giving quality of information is important so they could choose if this kind of treatments could work for them.
Doctor, thank you very much for clarifying for us all of those important concepts of regenerative medicine. But let's try to keep it simple. I want to understand, what would you tell to a patient that comes to you, let's say with knee osteoarthritis? How would you explain to them the regenerative medicine and practices?
Okay. The OA, osteoarthritis, is basically wear and tear of the cartilage. They won't repair itself. Cartilage is avascular, meaning it has no blood supply of its own, which makes natural repair very difficult. These therapies give the tissue back its ability to recover.
Okay, and let's try to rewind a little bit. You explained to us 4 different types of practices of regenerative medicine. Which one of them would you say it's better for this kind of treatment?
Okay, we have 4 that we say exosomes, mesenchymal stem cells, PRP, and this lysate of platelets. In general, this works very well, but the doctor decides for you what is the best option in each case. We could start with one treatment, or we could do a mix of different treatments at the same time, trying to find what is the best answer for you and trying to find what will be the best result for your body and the recovery. That is the most important.
That's really impressive. We could say that it's a tailored solution for each person. Let's try to put another example. What about chronic pain? How would regenerative medicine treat chronic pain?
Okay, totally. Chronic pain is like living with the handbrake on every single day. Is usually an internal fire. Chronic inflammation, the body can put out alone. In countries like South Korea, using salt from a patient's own fat to treat osteoarthritis or rotator cuff tears is routine and clinically proven to improve function and lower inflammation.
Okay.
And in other countries like Japan, South Korea, these therapies are using more and more frequently in many spaces, mainly in the vet clinics that have these advanced protocols.
That's impressive. Let's try to pin this down to a local context. And me personally, I'm very interested into learning and hearing about the experience of a local patient of yours. Let's talk about one. How was it? Tell us more about the story of this Casanares man that was one of the patients of Dr. Ernesto Nieves and who got the perfect treatment for his source of pain.
Okay, we have many patients, but I'm going to give you a nice example. Don Juan is a patient who works a lot since he was young into the farms. He wake up so early. He was working all day, and suddenly he had some medical condition. He was in intensive unit care for like a 6 months, and
Wow.
that recovery after he was at his home was very difficult. He comes with me. We did medical evaluation, some tests, some exams, labs, and we decided to start a novel therapy with the stem cells. And now it's impressive. He could return to start the things that
Wow.
he can do before because this chronic illness. And now he feels like a new. He's started doing the things that he can do before. It's impressive. If we could hear his story and how he feel and now how he feel the life, that is the real things that the stem medicine and regenerative therapies do for our patients.
Okay, Dr. Ernesto Nieves, I have a really special surprise for you. We're going to do a little bit of a dynamic because we have a tons of questions about regenerative medicine. And now that we have you here as the expert of today's episode, I want to, use that in our favor. And we're going to answer a couple of questions from our whiteboard. So here we have our Google search with the most common questions about regenerative medicine, as you can see here. And let's find out what the audience needs to ask. Good. Very first question. How much does it cost?
Okay, is I could say the price could change between different countries, and could be around in our clinic between $400 to $2,000 in age treatment. In other countries like United States or Japan, this cost could be more highly, obviously, to maybe 15 to $20,000.
Wow, that's a really, good range and also a huge difference with other countries. Let's try to find out the second question. Okay, how long until it works?
Okay, weeks 1 and 2 might have some discomfort or feel nothing. Between weeks 6 to 8, you start notice subject improvement in the pain, more energy, and at 6 months you see the consolidated result. So we expect that our patients start improving from day 0 to 6 months, where we could feel the best result in this therapeutic.
That's a really good timeline. And we saw it on the last section talking about Mr. Juan, who could recover eventually in 6 months and could eventually do all of the activities that he used to do without any pain or problem. Let's find out question number 3.
Okay.
Let's see.
What is that?
Okay. Can I combine this with physical therapy?
Okay. Yes, they are practically compatible. Physical therapeutic approach combine very well the stem cell therapy and the prescription of the exercise.
Great. That's perfect. Let's hope for the last and final question. Let's see. Okay. We're talking about age. When is it too old to do this? Am I too old to do this?
Okay, seniors often benefit the most because joint wear is cumulative. The chronic illness appear between more age you have. And yes, older population is the best candidate to having this kind of treatment. To have better results is when you start feeling like something in your body is not working well. But you start feeling results even in more advanced cases of osteoarthritis or inflammatory processes.
It's important to notice the place where we are currently standing on. It's Clinica Nieves, the most important place to treat and to pursue regenerative medicine in Casanare, and why not in the Orinoquia region? I want to talk about Casanare. It's an enchanting destination. We're currently working towards bringing more visitors to enjoy the perfect nature that actually is surrounding us. And I would like you to explain, Dr. Nieves, how does this relate to the treatment of regenerative medicine? I would like to note that Casanare is full of biodiversity. We have enchanting landscapes, and we also enjoy a really rich ecosystem with the fluted savannas, which is one of the most iconic scenes in the entire planet. And I would like for you to tell us how this enchanting nature experience relate to the recovery of a patient that is being held here in Clinica Nieves for regenerative processes.
Yes, that is a beautiful question. Modern medicine often forgets that the body doesn't heal with medicine alone. It's healed with calm, natural light, and the sun of water. Patients here tell us they sleep differently. When the nervous system drops its guards and there is no traffic or rush, cells do their work better. Regeneration flows more easily, and that is important. Uh, Regeneration is not only put IV stem cells. Regeneration is about to understand that the body needs that important connection between nature and quality health system, quality products in stem cells or other kind of products that could help the body to recover. It's an interaction between your soul, your body, and a nice products to help you.
That's beautiful. So, if you ever consider to get a treatment in regenerative practices or medicine, please also consider the environment where you are going to be relieved from that pain and, of course, recover from the process. So, now what's next for you? After hearing all of this important conversation and learning the most valid concepts of regenerative medicine, what's the step that you're going to take? Well, if you're listening to this and you're feeling severe pain and you're facing probably a surgery on your joints, you need to take care of yourself. And let's try to take a first step. You don't need to make any severe decision today. You can take the first step on evaluating yourself and check if you're a candidate for medicine and all of these practices about regenerative medicine.
Yes, you can contact Clinica Nieves directly using the phone numbers listed on the screen or website. Tell us about your situation. Our team will give you an honest assessment of whether it is an option for you.
And if this episode gave you some hope and some important information to understand better why this treatment is the perfect fit for you, you can share this with your friends, your family, or other important people that surround you that could probably find this information helpful. Thank you, Dr. Nieves, for being here today with us, and we'll see you in the next episode.
Thank you for the invitation.
See you in the next episode.